Cancer is one of the leading causes of death in our country today. In fact, after cardiovascular diseases, maximum deaths happen in the country because of cancer only. More than 1.4 million cases are added every year in our country due to cancer, and more than 800,000 people die or lose their lives because of cancer. The biggest challenge for these kind of numbers is that today the infrastructure for cancer care services is largely limited to capital cities, metro towns, and bigger cities in the country today. Majority of the people do not have an access to these facilities, and because of the late detection and diagnosis, we see a high number of deaths because of cancer. If you see, for cancer treatment, we have got three pillars. One is surgery, one is chemotherapy, or known as medical oncology, and the third one is radiotherapy. Globally, 50% of the cancer patients have an access to radiotherapy treatment, whereas in India, these figures are abysmally low at about 18 to 20%. WHO guidelines suggest that we in our country need to have one linear accelerator per million population. Linear accelerator is the equipment which is used to give radiotherapy treatment. Unfortunately, in our country, we just have about 700 linear accelerators clinically commissioned. 85% of these LINACs are in the private sector. So in government, the situation is even bad, I would say, in terms of facilities for cancer care treatment. Geographical distribution, if you see, we just have about these facilities in around 120 districts, which means not even 20% of our country or the districts have this kind of a facility. And the biggest challenge is that the patient has to go multiple number of times, maybe 20 times, 25 times, or over a period of 30, 35 days for the getting the treatment with linear accelerator. Because of moving to a different city, to a different town for the treatment, majority of the patients are not even able to complete their treatment. And they have to lose it because it's an economic burden on them to move to a different city, lose their livelihood, and so on and so forth. I think government can surely play an important role in bringing cancer care facilities to a larger population of the country today. We sincerely believe that government needs to look at creating a holistic program for making the cancer care facilities accessible to the population of this country. They can target, let's say, around 300 to 400 districts over a period of 4 to 5 years, where we can think of setting up cancer care services or cancer care infrastructure in the country with facilities of radiotherapy treatment as well. Today, with the technology, with the development in technology, we can use hub and spoke model, whereas the centralized planning center can be done, can be set up as a hub, and then which can be further connected to 4 and 5 smaller centers as spokes, where the treatment to the patients can be delivered. Government also needs to look at, collaborating with the private players by setting up public-private partnership, models in the radiotherapy for the radiotherapy centers. We have seen a huge success, in the diagnosis spaces, in the radiology, in the pathology space, where we see a lot of centers running across the country on PPP-based model. Even in the treatment segment, we have seen that nephrology, dialysis centers have been fairly successful on this kind of a model. So I think government can definitely look at creating a document, a policy paper, where they can come out with guidelines for setting up radiotherapy centers on PPP-based model. The creation of a holistic program will not only help in increasing the access to cancer care services, but will also, combine with the Make in India initiative of Government of India, whereas linear accelerators can then be thought of bringing into the country from a localization of technology point of view. Today, globally, we have two organizations manufacturing LINACs. However, the market is not big enough in the country today that they can think of setting up manufacturing plants, or maybe transfer of technology for the localization of LINACs in the country. If the government can look at centralized procurement, a creation of a national program on cancer care, I'm sure the technology can be then brought into the country, which can then also lead, in subsequent years in bringing down the cost significantly for these kind of equipment. Thank you so much.